Hello people, this is Health Zone and this is Lucine. We are going to talk about depression and what you need to know about each of these types of depression. There are more than one kind of depression. Here, experts explain major depression, seasonal depression, affective disorder, postpartum depression, and more. So let's talk about this depression and what you need to know about depression. Under the big tent of depression, there are many shades of gray. Depression can be mild or severe, it can be short-lived or chronic. Special circumstances like the birth of a baby or the changing of the seasons can trigger depression symptoms. Understanding the type of depression a person is experiencing helps doctors determine treatment, and for the people who are diagnosed with depression, having information about their specific disorder can be helpful. Folks seem comforted in knowing what's going on for them, says Sarah Noble. Though a psychiatrist with Einstein Healthcare Network in Philadelphia, at least they have an answer for why they are experiencing what they are experiencing. Here's what you should know about a different type of depression. If you suspect or a loved one has one of these, get evaluated by a mental health professional. They can help you figure out the diagnosis and the best course of treatment. Let us all start with major depression disorder. In a given year, more than 16 million Americans, a majority of them are women, experience this very common type of depression, also known as major depression or clinical depression. Under diagnostic criteria published by the American Psychiatrist Association, people must have at least 5 symptoms persisting for 2 weeks or longer to be diagnosed. With major depression disorder, these symptoms can include feelings of sadness, emptiness, worthlessness, hopelessness, and guilty. Loss of energy, loss of appetite or interest in enjoyable activities, changes in sleep habit, and thoughts of death and suicide. Most cases are highly treatable. Major depression disorder has two subtypes, atypical depression and a melancholic depression. People who fall into former category tend to sleep and eat a lot. They are emotionally reactive and very anxious, Dr. Noble explains. These in the latter category have trouble sleeping and tend to ruminate over guilty-ridden thoughts. She says, young adults tend to present with typical depression and a melancholic type is seen more often in seniors. And treatment-resistant depression. This is another type of depression. With treatment-resistant depression, sometimes people with major depression disorder don't readily respond to treatment. Even after trying one antidepressant and then another and another, maybe a third or fourth, their depression stubbornly hangs on. Maybe it's genetic, maybe it's environmental, Dr. Noble says. Their depression is just tenacious. Helping people overcome treatment-resistant depression begins with a thorough workup to ensure a proper diagnosis and identity, other psychiatric and medical causes of their symptoms. Patients are counseled on proper dosage and duration of treatment. If a medicine isn't working, doctors will try switching to a similar drug or one from a different class. Patients may benefit from adding second antidepressant from a different class and perhaps another type of medicine such as an antipsychotic. And let's jump to subsyndromal depression. This is another type of depression. A person who has depressive symptoms but doesn't quick check all the boxes for a diagnosis of major depression may be doomed. Subsyndromal, maybe she had 3 or 4 symptoms, not 5, or maybe she's been depressed for a week, not 2. Dr. Noble explains. Rather than look at symptoms, I usually look at functionality. She says, is the patient able to go to work and take care of day-to-day responsibilities? If the person is struggling, they may still benefit from treatment, including with medication, she says. Let's jump to persistent depression disorder. This is usually called PDD. People with persistent depression disorder, which is PDD, have a low, dark or sad mood on most days and at least 2 additional symptoms of depression lasting 2 years or more in children and teens, teenagers. PDD, also called dysthymia, may be diagnosed if symptoms of irritability or depression persist for a year or more. It may wax when in intensity, but generally it's a low level of depression. To be diagnosed with this type of depression, people must also have 2 of the following. It doesn't have too much sleep or too little, it's all of them. Low energy or fatigue, low self-esteem, poor appetite or overreacting, poor concentration or difficult making decisions, and feeling of hopelessness. Usually, PDD requires a treatment with a combination of medication and psychotherapy. Let's jump to premenstrual dysphoric disorder. It says that up to 10% of women of childbearing age experience premenstrual cyclic disorder, which is usually called PMDD. This severe form of PMS can trigger depression, sadness, anxiety, or irritability, as well as other extreme symptoms in the week before a woman's period. It can be really uncomfortable, disabling, and interfere with a woman's day-to-day life, says Dorothy Seed, MD, Associate Professor of Psychiatry and Behavior Sciences at Northwestern University Feinberg School of Medicine in Chicago. Scientists believe these women may have an abnormal sensitivity to hormone change during their menstrual cycle. Taking antidepressant, especially selective serotonin reuptake inhibitors, in the 2 weeks before their period or throughout the month can be very effective. Dr. Seed says, certain types of conceptions may help too. Researchers at the University of California, San Diego are exploring the use of light therapy to improve sleep quality and mood in women with PMDD. Bipolar depression, and this is another type of depression. With bipolar depression, wide swings in mood and energy from elation to helplessness are the signature of bipolar depression, also called bipolar disorder or manic depression illness. To be diagnosed with this form of depression, a person must experience at least 1 bout of mania. Bipolar usually shows up in young adulthood, while women and men are diagnosed in equal numbers. Studies point to possible gender differences. Men appear to have more manic behaviors. Women tend towards depression symptoms. Bipolar usually worsens without treatment but can be managed with mood stabilizers. Antipsychotic medicines and talk therapy. While further research is needed, a recent study by Dr. Seat and colleagues suggests light therapy may be a potential treatment for bipolar depression too. Compared with dim placebo light, daily exposure to bring light at midday may reduce symptoms of depression and improve functioning in people with bipolar disorder, the study found. And this is Rosine on the mic. So let's jump up with another type of depression that is called disruptive mode dysregulation disorder. Screaming and temper tantrum can be features of disruptive mode dysregulation disorder, which is also called DMDD. A type of depression diagnosed in children who struggle with regulation their emotions. Other symptoms include an irritable or angry mood most of the day, nearly every day, and trouble getting along in school, at home, or with their peers. These are the kids' strong emotional outbursts, Dr. Noble said. They are just not able to contain their emotions, so they act out and act on their feelings. Currently, DMDD is treated using medications, psychotherapy, and parent training on how to effectively deal with a child's irritable behavior. This is another type of depression called postpartum or perinatal depression. Perinatal depression. The birth of a baby brings enormous joy but can sometimes lead to postpartum depression, PPD, a type that affects 1 in 4 women and 1 in 8 men. In women, postpartum depression is likely triggered by shifts in hormones, fatigue, and other factors. And in men, it's environmental, brought on by shifting rules and lifestyle changes that come with parenting. Postpartum depression can begin anytime in the first year following a child's birth, although it usually appears soon after the new arrival. Intense feelings of sadness, anxiety, and exhaustion becomes overwhelming and can interfere with daily life. It can provoke thoughts of hurting yourself or your baby, compared to the baby blues, which is a mild, short-lived, and extremely common condition causing anxiety and depression symptoms in immediate wake of a baby's birth. PPD usually requires treatment with antidepressant and or talk therapy. BetterHelp is a top-reviewed online therapy option to help guide new mothers through challenging times and provide treatment options. Let's jump up to another type of depression, and on mic, this is Rosine. Remember, this is Health Zone. This is called seasonal affective disorder. With seasonal affective disorder, which is also called SAD, is a recurring type of depression, also known as seasonal depression, that usually strikes in the fall or winter. Along with the change in the mood, such sufferers tend to have low energy. They may oversleep, crave carbs, gain weight, or withdraw from social interaction. Women and younger adults are at higher risk of developing SAD. It can also run in families. SAD is diagnosed after at least 2 years of recurring seasonal symptoms. While the exact cause is unclear, research suggests it may be related to an imbalance of the brain chemical serotonin, an overabundance of sleep hormone melatonin, and insufficient levels of vitamin D may also play a role. SAD is typically treated with a daily dose of light therapy and sometimes medication. Substance-induced mood disorder. This is another type of depression. Using or abusing sedating drugs can change your mood. Symptoms such as depression, anxiety, and loss of interest in pleasurable activities typically appear shortly after taking or abusing a substance or during withdrawal. Substances that can lead to this type of depression includes alcohol, if you drink too much, opioid, painkillers, and benzodiazepines, which act on the central nervous system. To diagnose someone with a substance-induced mood disorder, doctors must rule out other potential causes of depression, and the depression must be severe enough to interfere with daily activities. Let's jump up to another type of depression. This is called psychotic depression. With psychotic depression, people with psychotic depression have several depression accompanied by psychosis, which is defined as losing touch with reality. Symptoms of psychosis typically include hallucination, seeing or hearing things that aren't really there, and delusions, false beliefs about what's happening. One of Dr. Noble's patients, 2 years after beginning treatment, confessed that she had a year during which she would not eat anything her father cooked because she thought he was poisoning her. The woman was otherwise lucid. She simply suffered from psychotic depression that had not been fully treated. Doctors usually prescribe antidepressant and antipsychotic medicines together to treat psychotic depression. To get our top stories, you can visit Health Zone, and remember to subscribe, share, and like. Your comment really is helpful here. Thank you so much. This is Health Zone, and I is Rosine. So we can't go on without saying depression due to an illness. Depressing due to an illness, coping with a serious chronic disease like heart disease, cancer, multiple sclerosis, and HIV and AIDS can be depressing in and of itself. Adding insults to injury, there is now evidence that disease-related inflammation may also play a role in the onset of depression. Inflammation causes the release of certain chemicals by the immune system that cross into the brain, leading to brain changes that can trigger or worsen depression in a certain people. Dr. Noble explains antidepressants may help prolong their life and improve their ability to function. She says, and therapy can help many patients cope with mental and psycho illness. Thank you for being us in this. We've been talking about depression, and hopefully we'll be talking about other things that may help your life. And this is Health Zone, and I is Lucine Rowide. Remember to subscribe, like, share, and your comment is really helpful. Thank you.